Hi, I'm Dr. Erica Black with the Hearing Doctor, and today we wanted to give you a view of what actually happens during your initial appointment in our office. So patients start off coming back to this room, and this room is our sound booth and where we test patients. So the first thing we do when a patient comes in is they have a seat, we look in their ears and determine if there's any wax or anything impaction that needs to be taken out. Based on that, we can clean out their ears right here. We've got our full sinks, all of our equipment to clean ears. So as audiologists, we clean ears all day long. So we start here, make sure ears are nice and clean. And then from there, you can follow me. We go into our sound booth. So in our sound booth, the first thing we do after checking the patient's ears is that we run a test to make sure that their eardrums are moving normally. So make sure there's no fluid, infection, anything behind the eardrum that we can't see. And we want to do that test because if we don't do that test and know where the hearing is and that the middle ear is functioning normally, then our test results could be skewed. So we want to make sure the ear's free of wax, there's no wax impactions in there. And then we check the eardrum movement, make sure the eardrums are moving normally, and then we start the testing. So our patients have a seat here, and then we either typically we put our insert headphones in. So they look like this, and they have one for each ear that goes in the patient's ears. And then they get their beautiful button, and patients get this button and they just push the button when they hear a beep. So this is the first part of a hearing test and what we do with patients. After we do that test, the next test we do is called bone conduction. And why would we do something like this? Well, a bone conduction, it goes back behind the patient's ear just like this, and it's actually going straight to that bone, which vibrates into that organ for hearing. And we're checking two different ways. So we check through the ear canals and then also through bone conduction to make sure that those tests are lining up. If they're not lining up, then we know that there's something going on with the middle ear space, and maybe we need to determine what's going on there, refer on to see if it's a surgical thing that needs to be handled surgically, or if there's maybe some fluid that needs to be resolved first, and determine what's going on with the hearing. So that's what we do in here. And then after we do that, we do some word understanding testing, how the patient processes words. And then my very favorite test, which is speech and noise testing. And we test the patient in background noise. Because as you can tell, how well you can hear in a padded cell hopefully is not your real world and doesn't tell us much about how you hear in the real world. It's great for programming hearing devices and finding the best you can hear, but it doesn't tell us how you function. So the speech and noise testing is beneficial to tell us in background noise, or when there's other people talking and you're trying to listen to that one person, how do you do? And all of that information together is what we call a comprehensive hearing exam. So if you have more questions about what is entailed in our hearing testing, or if you want to know more about our office, feel free to give us a call, 806-798-3600. Once again, I'm Dr. Erica Black with the Hearing Doctor, where we connect people to people through better hearing.